Hello, this is Dr. Bhatia. I am recording this video from Pediatrics Healthcare Associates, and there have been a lot of questions about the recent surge in COVID-19 and how do we differentiate between different infections which are common during the winter season and throughout the year, actually, in some parts of the country. So I thought of putting this together and kind of differentiating between RSV or the respiratory syncytial virus, the COVID-19 or the coronavirus, the influenza, and other viral infections and asthma exacerbations. So, one size does not fit all, but these are sort of the general guidelines, so as to say, to differentiate between these common viral infections. Starting off with RSV, usually the symptoms are more severe in children less than 1 to 2 years of age. They're more common in premature children and immunocompromised children, and the symptoms can be pretty severe in children or infants less than 6 months of age. Like I said, premature children are really predisposed to RSV, and children with chronic lung diseases, heart diseases, and again, infants less than 6 months of age are the common predisposing factors per se. The common symptoms include fever, fussiness, cough, increased work of breathing, and they can have hypoxia or decreased oxygen saturation levels per se. Usually in little babies less than 6 months of age, these symptoms can be pretty severe, and you will see that their work of breathing sometimes can be very increased, with their rib cage kind of moving inwards when they breathe and their abdomen kind of going outwards when they breathe. This is called paradoxical breathing and respiratory distress in medical terms per se. So the general treatment is, sometimes just supportive care depending upon the severity of symptoms, and you can give them oxygen if they are hypoxic or if their oxygen saturations are low or less than 92% or so. They might need some IV fluids if their oral intake is lesser or compromised, just because they have so much of upper respiratory symptoms and lower respiratory symptoms. So it might be a little bit hard for them to breathe, and then they can't keep up with their eating and stuff like that. So, they might need some IV fluids and all, depending upon the severity. And since I'm an ICU doctor, we see, some of these babies who will get intubated and stuff like that. So, or need more than just regular oxygen per se. So again, everything is a spectrum, but that's what RSV generally, the spectrum of RSV disease is. So moving on to COVID-19, children from any age group can get affected. What we have seen a lot of teenagers and adolescents kind of getting infected with this, but for unknown reasons, which we don't know. Probably it's their immune system more than likely, but children appear to have less severe symptoms than adults. But definitely they can be carriers, and some children do get sick, especially children who have or are immunocompromised, or who have diabetes and stuff like that. They can get infected with COVID-19. Asthmatics can get affected with COVID-19 as well. The common symptoms that people or children will have include fever, runny nose, cough, malaise. You can have a decreased oxygen saturation. GI symptoms are really coming up as well. We've seen a lot of that. They can have vomiting and diarrhea as well. And then you probably have heard about the multi-system inflammation, or the multi-system inflammation syndrome, in which basically a lot of the body systems get inflamed and they can get very sick. The incidence of it is low, but it can happen. So the treatment is still evolving per se. What we know from the adult literature is that dexamethasone is a kind of steroid, which is helpful. They might need some supplemental oxygen. And then there's this new drug which you've heard probably about, remdesivir, which is still under trial but has been shown to be of benefit for children who end up getting admitted to the intensive care unit. So, it's an IV drug, so really not relevant in the outpatient world per se. And then, a lot of the ERs have protocols about considering antibiotics and stuff like that, such as ceftriaxone and azithromycin and all, depending upon the institutional protocol. There are different testing now available for COVID. There's the antibody testing, and then there are the plasma titers and stuff like that. So again, that also depends upon the availability and the institutional protocol per se. So moving on to flu, any age group can get affected with flu again. Children at less than 2 years of age are at risk for complications of flu. Children with neurological conditions or other chronic conditions such as heart disease or chronic lung disease are at a higher risk. These children will usually present with high fever, fussiness, runny nose, cough, body aches, and they might have a pneumonia-like illness. Superimposed infections are common with flu, and the treatment for it is usually, make sure that you get vaccinated or get your child vaccinated. And then, Tamiflu has been shown to be helpful in reducing the length of the symptoms per se. A lot of GI side effects, so be careful about that. But Tamiflu in the first 48 to 72 hours of the onset of symptoms can be helpful. So moving on to asthma, children usually we diagnose them with asthma around 2 years of age or so. Especially if you have a history of asthma in the family and the child has been wheezing and stuff like that frequently. So, that would give them a diagnosis of asthma. Your pediatrician should be able to diagnose them with that. And, predisposing factors are children with a history of asthma exacerbations, frequent ER visits, poorly controlled asthma, requiring albuterol a lot or uncontrolled medications. Those children can obviously, get affected with an asthma exacerbation. And all viral infections listed over here can cause an exacerbation of asthma symptoms per se, and cause children to go into either an exacerbation or sometimes even into status asthmaticus, which is that you have severe increased work of breathing and difficulty in breathing, severe cough. Sometimes children may become very air hungry and even become cyanotic or blue because of increased work of breathing or not getting enough oxygen in. So, the treatment for that is basically bronchodilators. Bronchodilators essentially means that there are medications to dilate the bronchioles or the tubes in your lungs per se, or the alveoli. So the bronchodilators include albuterol, ipratropium, or the Atrovent, and then magnesium is another medication we use sometimes, especially in the ERs. Steroids have been shown to be helpful, oxygen, supplemental oxygen if the oxygen saturations are low. So those are the common medications that we use for asthma exacerbation. So provided they're not COVID positive, usually the hallmark is going to be wheezing, and that's a kind of a high pitched sound that you can hear in your lungs, and sometimes it's audible, even without a stethoscope and stuff like that. So other viral infections such as rhinovirus, enterovirus, adenovirus, these are all tested on something called a PCR panel. They can happen in any age group. So younger the child, the more predisposed you are to viral infections, just because your airways are narrower and you cannot, clear up the secretions. The immune system is not well developed at all. So, or very well developed as as adults. So there's no specific predisposition for these viral infections, but immunocompromised children, again children with heart diseases and chronic lung diseases, are more predisposed, and they get severe symptoms sometimes with these other viruses. The common symptoms are again fever, runny nose, coughing, increased work of breathing. Some of these viruses will cause a rash as well, such as enterovirus and adenovirus. Enterovirus sometimes will cause some GI symptoms as well, such as diarrhea and all. The treatment for it again stays supportive, and you give them oxygen if they're hypoxic or if their oxygen saturations are low, IV fluids if they're not eating, drinking too well, and then those are the common, basically these viruses, especially RSV and rhinoenterovirus and adenovirus and all. They'll usually last up to a week or so, and then after that the children start getting better. For RSV, usually we say they peak at around 4 to 5 days of illness or so. And so those are the general guidelines for treatment of and the diagnosis of all of these viral infections. So yeah, feel free to call us if you're trying to figure out what your child has. We're always here to help. And that's what I wanted to say about this. And thank you so much for your time and listening through this. Bye bye.